A tip to great coding is knowing where you're going. And you can't do that if you don't have illustrations, right? This is what I love about having the book because it has illustrations, it has diagrams. So when you're coding a specific area or specialty, it's great to reference the illustrations in the book because it one, as you can see, it has the name of the anatomical locations, and it shows you how specific activities or functions flow within that particular industry. So here we have the heart, and so it shows us the different anatomical parts of the heart, and based on the arrows or the directions, it's showing you how the blood flows through the heart. So yeah, so I love this. And then of course we have our circulatory system here. Again, it breaks down the vessels and the arteries and things of that nature. And then if we proceed further, now if you're into gastroenterology, surgery, or surgical coding, this is definitely a good medical illustration for you because it shows you how the digestive system works. And so when you're reading the operative report, it also shows you um, the process and how food enters the orifice and then how it is eliminated from the body. So yeah, so when you're reading the operative report and the surgeon states or specifies they're working in a particular area, you can reference your medical illustrations to show you exactly where they are and what they're working. And I would say this has helped me a lot when it still helps me a lot as a coder because I'm able to reference this and I'm able to kind of walk through the surgical procedure with the surgeon by way of looking at these medical illustrations. And then of course it has further illustrations. If we're going to look like I guess focus on the mouth anatomy, it breaks that down to for you as well, especially for those like who are coding like I would say dentistry or again any type of mouth procedures. Here we go. Again, the tongue, and then we'll go further. It just really breaks down the digestive system even more so than what the original illustration reflected, showing you the different parts of the stomach anatomy as well as the intestines, the small as well as the large intestine, the rectum. And then it's pretty much there is a whole section of images or illustrations again to help a coder new as well as older expert coder when they are coding particular procedures or surgeries. It's just really good to have. Let's see here. We'll have the eye. The eye. So again, as I say, if you don't know where you're going, you can't code successfully, if you don't know where you're going, right? If you don't know where you're going, or if you don't know where the surgeon or the provider is going or has gone, you know, again, make use of your illustrations, make use of your anatomical images again because it helps paint the picture of what the surgeon or the other clinician is doing or providing. And then also it just is other words coding. If you look at coding as telling a story, so the patient encountered the physician or the clinician, and so the clinician's documentation is really just recapping or retelling what transpired during that encounter. So you have to look at your coding to translate what took place. So again, the surgeon or the physician or clinician is telling you what transpired in verbiage, right? And then it's up to you as a coder to translate that same information into code. So you're going to tell the same story, but you're telling it in the way of codes. So yeah, so again, this has helped me a lot in my journey as a coder, and it still helps me a lot in my journey as a coding instructor, as well as a general surgery coder. So yeah, so again, this is located in front of the ICD-10 CM manual, and I'm sure it's also in the CPT manual as well. But right now, I'm actually looking in my ICD-10 CM manual. So again, use those images. I've been in the industry for almost 30 years and I still reference the images to help guide me in my coach selection. So yeah, that's all.